administrative expenditure. So there's been a lot to digest in this latest Auditor General's report, and especially about why some key government projects were deemed unsuccessful. Now, what struck you the most about this report, Sharad?
Well, you know, Melissa, several things. One is that we keep coming back to the same story of waste and phenomenal levels of waste, especially on programs for the most needy in our country. So, I mean, I think that it's painful reading. Yeah. In fact, you know, if you want something to if you want to be brought to the brink of tears, you might want to read the Auditor General's report. I think the other thing is that we've seen these patterns established over a long time. And the question really is, and I believe this report is for the 2016-2018 period, the question is, why haven't they been resolved? So it's not just that, say, 58 million ringgit was wasted on a particular project, but the question was why? What could have been done to prevent it from happening?
So the project that you're referring to was one of the findings of the Auditor General's report was that programs aimed at providing those in the B40 with skills training had a budget of 258 million ringgit. That was mismanaged for the period of 2016 to 2018. And the other thing that really struck me, Sharad, was that 214,000 foreign nationals who had used the social visa pass to come into the country, there was no record of them coming out. And why there's no record of them coming out is because the Malaysian immigration system experienced a downtime of 4,500 times during the period of 3 years. 4,500 instances of downtime within 3 years.
And how many times a day is that?
That would average to about 3 times that the system went down in a day over 3 years.
Over 3 years. Now, I think, Melissa, so we can get I think, caught up in the thicket of facts and figures that the Auditor General. In fact, it's a field day for journalists. I think, you know, the idea is that...
There's a lot to digest.
Yeah, I mean, it's like 1MDB. I mean, it's a story that keeps giving, right? So here it is. We can start to, go granular, go deep into the question of good governance in this country. Yes. Question is, when are we going to turn the corner on these levels? I mean, the sheer intensity of waste.
I do want to point out that the Auditor General says that remedial action has been taken. So that action has been taken to about 1,000 civil servants or officers during that period of 2012 to 2018. But I want to point out to the breakdown of which 60% were found not guilty by respective internal investigations, 26% were penalized, and about 14% still have ongoing cases. So you can see that the bulk have actually been cleared by internal investigations. 2 people have been charged in court by MACC and 3 others sacked. But that's a small figure compared to the 1,000 officers that have been looked into.
Right. The other dynamic, is the question of the relationship between the civil service, on which many of these things blame is pinned on, and their political masters. I mean, to what extent do politicians and political masters of the civil service, as it were, in fact, constrain civil servants in their actions, or force them or put them in positions that are compromising, or where there might be a conflict of interest. And I think that is also one of the stories that really needs to be unpacked. But it's difficult when you don't have freedom of information, when you don't have a press that is robust, that's brave enough to actually bump up against vested interests.
Well, I have to say, though, that was a really good question that you asked in the very beginning about why this keeps happening and what we can learn from it. So the Auditor General's report comes out every year, sometimes several times a year, as we've seen in this case. Now, the question is, why do we still keep seeing the same kind of systemic repetition of wastages or unsuccessful programs? Should the AG's report instead be used as a reference when parliamentarians review how much budget to give to each department, how much expenditure should be allocated, and that can be the basis of, for projects that work and projects that don't seem to work.
Yeah, indeed. I mean, often I think the media, we are blameworthy when it comes to kind of simply reporting what politicians say they want monies to be used for. The numbers are always big. Is there follow-up? Do we go back and say, well, okay, what actually happened? Do we go to the ground and say, what did it have impact? whose responsibility? If the media is not given the resources to do that kind of investigation, then we'll only be reporting the big numbers as if that aspiration to do something necessarily translates into real action.
And it's very difficult when these reports come out. So much information is bombarded. There's a deluge of information that comes out all at once. So trying to digest that, and then the news cycle kind of moves on to something else. So we're going to keep looking into this and hopefully highlight some of the key areas of the Auditor General's report. But quickly in other news, UMNO Information Chief Sharil Hamdan has called for a federal job guarantee program. This as a way to address rising unemployment. It's generated some discussion and even more questions. How feasible is such a program, and how is it going to be paid for? And more importantly, is there going to be enough political support for it?
Yeah, Melissa, I think, in fact, the conversation is very important. I thank Sharil for kind of raising it. And even if it looks and sounds like the kind of programs have been raised or talked about in other countries, that's fine, because I mean, as a globe, we share some commonalities. I mean, most countries, have a capitalist economy. Many of the countries that we look to and model ourselves on are also democracies or semi-democracies.
You're referring to the fact that this conversation about the Jobs Guarantee Program has happened in the US and is happening. I think Bernie Sanders has talked about it and so on, right?
Yeah, absolutely. And so, but that's not a problem. It's not
a bad thing. Yes.
Yeah. The issue is whether we can separate genuine policy debates from grandstanding and political demagoguery and the kind of talk that's all about throwing out big numbers and making huge promises, but not getting into the details, right? And the devil is, as they say, in the detail, right? How exactly are you going to do it? Who's going to benefit? What is the time frame for such a program? Is there an exit strategy? Because especially if you think of something that is crafted specifically for a recession, is it going to be then
what happens after
that? Right.
Correct.
So big questions, philosophical questions about the role of government. Is government the right agent or actor for something like jobs?
And we on Consider This will look to continue that conversation about this job guarantee program and perhaps have a more in-depth look at it. But for now, we're going to take a quick break, and in just a few minutes, we're going to be delving deeper into what it takes to ensure equitable access to COVID-19 vaccines and treatment. So stay tuned to Consider This.
Baru. Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir.
This is Sharaad speaking.
Notifikasi berita terkini dan notifikasi mudah.
Good evening. I can see you, Leena, but I guess
you can't see us. Yeah, that's okay. No worries. But we can hear you loud and clear. Reformasi, resistance, and hope.
Okay, we're going to be starting in 40 seconds. Thanks again for doing this.
Dengan scroll tanpa henti. Buat turun aplikasi baru Astro AWANI sekarang.
Asrama Mahat Tahfiz Jawaban.
Bila sentuh soal berita, tiada masa untuk tunggu. Kepada anda kami bawakan fakta, susulan dan kupasan yang terkini. Tiada drama dan tiada pengulangan. Usah tunggu lama-lama. AWANI 745 lebih awal dari biasa.
Hello, you're watching Consider This. I'm Melisa Idris, with me, SharaadKuttan. While there has been much interest and investment in developing COVID-19 vaccines and medicines, there has been far less attention as to how we will manage and allocate the global supply of treatments and vaccines if and when we have them. Now, if science succeeds, will politics hinder equitable access to COVID-19 vaccines? Joining us on the show now to help us think through this question is Leena Menghaney. She is currently the South Asia head for the Access campaign for Médecins Sans Frontières, and her area of expertise is in public health and intellectual property. Good evening, Leena. Welcome to the show. Now, Should vaccines and therapeutics under circumstances like this pandemic should be seen as perhaps a global public good, meaning that they will be made equitably available to everyone in the world, irrespective of if you are a big country or a small country, a rich country or a poor country? What do you think?
Absolutely. I think one of the biggest challenges this pandemic has thrown up, that it actually reveals the inequities or the inequality in society and across countries. So there's always wealthy countries to stockpile vaccines and drugs in a pandemic or an epidemic, or to price them too highly. I think what we need cooperation of all countries under the WHO to agree that they will provide the drugs and vaccines to the most vulnerable. And that takes a lot of political will.
You know, Leena, when we talk in terms of nation states and governments, we can talk about political will because, you know, we elected them, we can force them to do things. They might want the legitimacy to act in particular ways. But on a global scale, what does it mean to talk about political will? Intergovernmental organizations like WHO, can they impose these values on hundreds of countries, literally? What is the reality of this, these values that are so important, as you rightly pointed out?
I think it's very important to remember we can't control or address this pandemic by just a few countries treating or vaccinating their way out of this pandemic. That's one. And number two is this, that when you have an agreement under the WHO, it should be applicable equally to all countries. To agree that irrespective of whether they are a manufacturing country, they contributed to the R&D, they contributed other funds, or they are a low-income country. All people deserve access. And these agreements have been agreed to in the past. So it's not as if, you know, countries can't agree to abide by certain rules. You see the TRIPS agreement on intellectual property. Today, all countries abide by the TRIPS agreement on intellectual property. Okay. So, of course, we can look at a better mechanism to agree to sharing vaccines, therapeutics and diagnostics.
But Leena, what about some countries who have shown that they want, you know, vaccine nationalism? The US has bought almost all of the world's upcoming supply of remdesivir, if I've got that right, the COVID-19 treatment drug. Now, how has that been allowed? How has that been made possible?
Well, you're absolutely correct. There's been some very short-sighted nationalism on the part of certain countries to try and simply say that, you know, if the vaccine or the drug is developed in our research institutes or by our companies, they go ahead and monopolize those. But that's not going to get us out of the pandemic. And the only way we can hold these countries accountable is by asking the tough questions. And for our countries, our governments, to be on the table to ask these questions. For example, for India and Malaysia, the WHO allocation framework as we speak, it's very important that our governments actually play a role in deciding how the framework will work. So it's absolutely imperative that our negotiators and our countries actually play a role in deciding how the framework will look like.
Leena, the location of a possible vaccine, if it ever happens, is that going to play a role? I mean, if it's a vaccine is developed in India or in China as opposed to the US, will that have an impact on the dynamics we will see unfolding?
Absolutely. I think every country has its own policy, whether it's Australia or, you know, India or the United States, on the issue of drugs and vaccines manufactured in their territory or developed in their territory. And I think this is the biggest challenge that the pandemic has sort of thrown up, is how do you get all these countries to cooperate with each other? I think the biggest challenge right now would be to get countries on the table to negotiate and agree to the framework. Now, if you look at what happens with remdesivir, Gilead's drug remdesivir, it's a modestly effective drug, not a game-changing drug, but all of its supplies have gone to the United States. Right. And other countries who need it for emergency use don't have access to it. And I think that's completely unacceptable to leave Malaysia out or leave India out from the supply of the drug. Right. And I think this is what we need to start challenging in the pandemic.
Okay.
Leena, do you see the possibility of countries like India, because it has a local pharmaceutical industry, it's creating, it develops generics, it has the scientific heft to do work like this. Could countries like India or China become the global leaders? Could they establish, because of their heft, new protocols or new ways of cooperation across the world, especially for the third world?
Well, I think it's quite clear that globally, if you look at it, whether it's philanthropic institutions or governments or other procurers, they're looking to countries like India and China playing a huge role in the production of drugs and vaccines. And I think this is why a dialogue with governments like India is so important, because they have a huge domestic need. A large part of the world's poor live in middle-income countries like India. They are also manufacturers of these products. So how will they strike a balance ensuring that they don't only look after their own poor, but they also look after global health, public health? And I think there is a dialogue that is possible with countries like India on this issue.
Leena, very quickly, I just want to ask you whether there are mechanisms to deal with stockpiles and global procurement, because, it feels like this is an unprecedented experience, but we do have lessons that we've learned from previous outbreaks. What are some of these lessons?
Well, what we saw in H1N1 was very, very, very clear that you had wealthy countries stockpiling the drugs and stockpiling the vaccines. And luckily, that didn't turn out to be a very big pandemic. And developing countries and middle-income countries had to scramble to try and get some access to the drug and the vaccine for H1N1. And I think this is, unfortunately, has not been the problem that has been addressed in COVID-19 pandemic as well. So the problem still remains that you have rich countries who can pay for the vaccines and drugs, and then they stockpile, and then developing and particularly middle-income and low-income countries have to scramble to access the vaccines and drugs. And it's completely unacceptable. But worse still, you can't get your way out of the COVID-19 pandemic with that approach. It just works.
Leena, thank you so much for speaking with us. Really, really appreciate your time and your insights. We're going to take a quick break and continue our look at equitable distribution of medicines and future vaccines in just a few minutes. Stay tuned.
Baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi mudah. Podcast dikemas kini dengan berita dan program.
Rebirth, Reformasi, Resistance and Hope.
Serta video tanpa had dengan scroll tanpa henti. Buat turun aplikasi baru Astro AWANI sekarang.
Asrama Mahat Tahfiz Jawaban.
Bila sentuh soal berita, tiada masa untuk tunggu. Kepada anda kami bawakan fakta, susulan dan kupasan yang terkini. Tiada drama dan tiada pengulangan. Usah tunggu lama-lama. AWANI 7.45 lebih awal dari biasa.
Thank you for staying with Sharad and I on Consider This. Let's continue our conversation about the distribution of COVID-19 medicines. Joining us now to discuss this further, we have Chee, Yoke, Ling, Director of the International Research and Advocacy Organisation, Third World Network. Good evening, Yoke, Ling. Thank you so much for joining us on the show today. So if and when a COVID-19 vaccine is available, the Malaysian government says that it plans to buy the vaccine, buy in bulk this vaccine from vaccine makers abroad and bottle it in Malaysia. They claim that it will speed up the process of distribution. The government has already identified 2 local pharmaceutical companies for the job. Now, help us understand, is this how the pharma industry works? Is this the way it operates?
Well, thank you very much. It's good to be here. Well, you know, we have, the government has done its research. So our two companies, Dua Pharma and Pharmaniaga, are the ones with the ability to do what we call fill and finish. But that is really the tail end. So we still are very dependent on importing the actual vaccine because we don't have the capability to actually manufacture vaccines. And the range of vaccines we are talking about now for COVID-19 they're sort of what they call RNA and DNA. So the technology is not an easy one. So we will be dependent on imports. And that means that looking at the global picture, the concentration of ability to manufacture these rounds of vaccines are very much in the hands of companies based in the developed countries. And they are very, very surrounded by intellectual property monopolistic killings. So it's not so easy to be able to buy the raw material for us to fill and finish when there's a shortage globally of a pandemic.
Ling, Melisa said if and when, and I wondered if we could just explore for a short while the if and when. What if we don't have a vaccine? Have other previous global pandemics help us understand the ways in which countries can cope without a vaccine?
I think this is a very important question because this is a public health infectious disease crisis, right? And the pandemic is global. So the issue is not about a silver bullet called a vaccine or medicines that can cure you get sick. We don't have that. And even a vaccine, if it does work, will actually need a few years. The fastest we understand from experience took about maybe 4 to 5 years. So all these political statements from, all these politicians saying, oh, we'll get one at the end of the year or next year, is false promise, okay? Because you want not just an effective vaccine, you want a safe vaccine. So you need to make sure that you are actually going to have a safe product. So I would just say, look at our Malaysian experience, right? We have contained the infection. We have actually brought it down. Let's touch wood. We are actually in a good state. And what is the solution to that? What is the public health response to infectious diseases? It reminds me of what our DG, our Director General of Health, DG Dr. Hisham said. Our vaccine right now is social distancing, all right? That is what it is about. It's a very collective, comprehensive approach. The medicines are not available. We cannot just pretend that a vaccine, if it comes out, is going to cure it, or prevent us from getting sick. So we're a long way from that. So we need to be very vigilant. We need a strong public health response. And we are very lucky in Malaysia. We have a public health system. They do contact tracing. Everyone who gets sick, you immediately get MOH coming in and questioning who you saw, who you were in contact with, and they track us down to everybody who we could have contacted, and then we treat, we quarantine, and that is the comprehensive response. And if you get sick, yes, you do need medicine. And we hope to get a vaccine to be able to prevent the disease from spreading, but that is not the only solution, right?
In fact, a lot of praise has been heaped on the ministry for its leadership, for its clear thinking. What could be done better? How could we empower the public health system? Are there models out there? People talked about Kerala, people talked about South Korea as models of responses. What's happening in Vietnam? Where can we start to learn better lessons and best practices?
What is the clear message from countries so far that they've been able to contain? We're not over it. This is going to be around for a number of years. We may have to live with this like we do with HIV and, dengue. But really, all the countries that have succeeded, you mentioned them, Kerala, the state in India, Malaysia, Vietnam, Cuba, some of our East Asian places. We moved fast and we actually have a public health system. Right? A public health system. In Malaysia, we've been having debates. Should we put more money into our public health system? We want to privatize better services in private sector. But everyone who gets sick today in Malaysia with COVID, you are going to go straight to the public hospital. Whether you're foreign, you're Malaysian, you're poor or rich. And that's how we can actually monitor the system. So I would say invest a lot more into our public health system. Okay? When it comes to public health, crisis and pandemic, you need a public health system of surveillance and response. When it comes to the medicines, as Leena said, we need access. We should not have, discrimination that the rich who get faster and hoard up the medicines and the vaccines if they work. We must have equal access, and we must also have transparency of pricing. The pricing of all the medicines floating around that may work, that may have a promise, it's ridiculously expensive because of the monopoly of intellectual property.
Well, I just want to ask you, you talked about access, Malaysia wanting to have access. Do we have the leverage to demand for that access? We are a middle-income country. You want to fight against some of the superpowers. We use the example of the US buying up all the, the future stocks of remdesivir. What can Malaysia do to get in the queue, to get the therapeutics or the vaccine, should we have one in the future?
I think there are two things going on here. One, why is there a shortage, and why, where there is available vaccines or medicines or even PPEs and masks and diagnostic kits, why are they so expensive? And I think the problem, is very clear, right? The system we have now for pharmaceuticals and medical products is that we give 20-year minimum, patent monopoly to those who so-called invent new products and new medicines and vaccines. And then they use that monopoly not to scale up production, but as a monopoly to keep up competition. So what we find is that even if something works, or all medicines that exist are kept under this monopolistic patent system, they become very expensive. So Malaysia, as a upper middle income country, we're always kept out of the cheaper range of prices. So what we have a great experience in this country, okay, 2017 for hepatitis C, when we could not get a negotiated reasonable price from Gilead, was so expensive, the government used its rights under a different treaty in the World Trade Organization on Intellectual Property, which allows us to use what we call a compulsory license. So we used a compulsory license, and we were able to roll out free treatment in this country, in the public health system, from $100,000 in the private sector, US dollars, 100,000 to $300 US. So we are treating in the public health system, hepatitis C cure in 12 weeks, about 1,000 ringgit, from 400,000 before, when we didn't have compulsory license.
Can you help us understand? There is a trade-off, isn't there, when you invoke compulsory licensing? Is that something that, Malaysian governments, and we're having shifting governments at this point in time, is that a trade-off they think they will want to make at this point in time?
Well, you know what? I am a person who fights for public health and access to medicines and treatment and comprehensive health care. I don't care who is the politician. I don't care what party is there. I want our government, our politicians, our members of parliament to understand what our rights as every country, as Malaysians have under international law and our national law. A compulsory license is something that we have a right to use. Now, in COVID, countries like Israel, they use compulsory license to have government purchase patented medicine. One of the antivirals for HIV. They actually use a compulsory license. Germany was actually changing its law to be able to go back to using compulsory license for COVID. So this is our right internationally under international law, and it's in our national law. So I would urge our government, be prepared to use it, all right? If we cannot get, good prices, if we cannot have the right to manufacture locally, we should have our legal right to use compulsory license to import and to manufacture in the long term.
Yoke, Ling, thank you so much for joining us tonight, helping us shed some light into this really complicated matter. We appreciate your time and your insights. That's all the time we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm SharaadKuttan, signing off the evening.
Thank you so much for watching. Good night.